Hello, my name is C. Cesar Dennis III, and I am a graduate student at the Penn West University, where I am studying CBT, cognitive behavior therapy. And today I am going to be demonstrating some cognitive behavior therapy skills along with my colleague, uh, along with a patient that I have currently. And I'm just going to go through the formal step of creating a therapeutic relationship with my patient. So in creating a therapeutic relationship with my patient, I may have already seen the patient chart. I've read about the information that brought the patient to the hospital or to the clinic or to wherever it is that I'm meeting the patient. So I've gotten some understanding of what is going on with the patient, how the patient is feeling, or how the client is feeling, the fear or anxiety that the patient is going through. So I've familiarized myself with that, and this is my first encounter with the patient or the client. And in order to make that patient or the client feel comfortable, I have to create or build a therapeutic relationship with the patient, because this is somebody that I'm meeting that I know from nowhere, and this person doesn't know me from anywhere, and they are here to trust me with the situation they are going through, in order for me to be able to address the things that they are going through. So in building the therapeutic relationship, there are some steps that we need to take in order to build a therapeutic relationship, which is the pre-interaction phrase. In that pre-interaction phrase, like I was explaining, is where I, as the social worker, will read the patient chart, understand what the patient is coming to, have a little clue of what it is before I meet the patient. And in that phrase, in the second step of that is the encounter, the initial encounter with the patient. In that initial encounter with the patient or the client, I introduce myself to the patient and introduce myself to the client and build a rapport with the client. In doing that, I establish a contract between the intervention that I'm going to be doing with the patient, gather data for assessment and all the kind of stuff, and put them together. And then start to work with the client on building rapport and promoting insight of what the patient is going through or what the client is going through, and then we work together from there. So throughout the therapeutic alliance, is building that relationship with my patient, is building the understanding with my patient that makes my patient comfortable to talk to me and to be able to work with me throughout the time of them being at the hospital or meeting with me one-on-one. So at the end of the day, it's the discharge process, the termination of the service of the patient. So whether the patient stay at the hospital for 2 days or 3 days or whatever it is, and we're working together, at the end of the day, the patient have to go home. That's the termination phrase of that. It comes to a conclusion where we plan and we work towards discharge, a safe discharge plan, and the patient go home and the patient continue to work from there. So that's what we're going to do here today. And I just wanted to give you a brief synopsis of what this whole thing is all about. And so I'll start the process. Okay. Hello, Viren. How you doing today?
I'm doing good.
It's nice to meet you. My name is CC Dennis. I am going to be your social worker, and I'm going to take this time to get to know you and understand why you're here today. And I'm hoping that we can be able to work together to work through the situation that you're going through.
Nice meeting you. Thank you.
Okay. So what brings you here today?
I've been suffering from too much anxiety, stress at work. Work is kind of overwhelming. short of staff. So for that reason, I have to work too many doubles, and that have been really taking a toll on me.
Okay. And if I heard you right, you're saying that you have a whole lot of stress that is going on from working um, more shifts than you usually work.
Yes.
Let's say that again.
I say yes. Yeah,
Okay.
too many
So,
shifts that I usually work because of the shortage of employees.
so how does that make you feel?
Sometimes I get angry because it kind of interfere with my personal life. I do have little kids, and because of that, the time I'm supposed to, the amount of time I'm supposed to spend home with my family, I'm not doing that anymore because I have to go to work, and that causing kind of serious problems.
You say it's causing serious problem. What other problem are we talking about?
The problem here is taking time away from me being able to spend quality time with my kids.
Okay. And you have already identified that you're working more shifts, more hours than you usually work, and that is causing stress in your life and is taken away from your family and taken away from your children. So, what are the better way that you think we could go about reducing you working overtime or working too much shifts or hours so that you can be able to spend some quality time with your children and your family?
Uh, right now, I'm between a rock, I would say, because one side, if I don't go to work, I won't be able to have that financial support to take care of me and my kids. And then if I say I'm staying home all the time with my kids, I won't have that much to be also able to take care of my family. So the better way is for the job to be able to find employees to come and work. Even though I know they try, there are vacancies being posted
Mm-hmm.
for almost a year now. Yeah, and then still people are not applying. So for that reason, it's the few staff that working with the agency have to cover up. So I don't know whether I am to be blamed or the agency is supposed to be blamed. I don't know, but it just kind of stressing me up. I really hope that people can apply for the position so at least the workload can kind of reduce.
Okay, if it is okay with you, can I interrupt you over there a little bit?
Sure.
Okay, so given the circumstances right now, the shortage of the job market, your job not having an employee to be able to meet up to cover the shifts, and you have to do those double over and over and again, are there other employees within your organization right now that are able to cover some of those doubles or those
Sure,
shifts?
yeah. Yeah, it is not only I alone. Yeah, every one of us that there right now have been working since after the COVID. Have been
Mm-hmm.
working with our schedule to cover the different vacant shifts. Yeah, everybody is involved, but the fact that we just are not many.
Mm-hmm.
Yes,
And that is causing serious burnout.
yes,
Okay. So if it is okay with you, can I obtain your permission to see if we can establish some goals that you can be able to limit the hours that you're working so that you're not burnout and be able to spend
sure,
some time with your family? Okay.
yes.
So how many hours do you currently work?
That week sometimes work about 80 hours that week.
Is that not a
I'm supposed to be
usual?
working for, I'm supposed to be working 40 hours per week, but sometimes I work 80 hours per week, and
Okay,
I work from Sunday to Sunday, 7 days straight.
already. So
Sometimes.
if it is okay with you, can I write some of the things that you're telling me down so that we can be able to build a good plan that is going to resolve some of the issues that you're going through?
Yes.
Already. So according to you, you work 80 hours. You're supposed to work 40 hours a week, right?
Yeah.
But now you find yourself working 80 hours a week.
Yes, sometimes 80 hours. Not every week I do 80 hours. Sometimes I do it, but most of the time I do 80 hours, but not every week. Yeah.
Already. So what are your days of work?
I just start on Saturday, Thursday. It's that Thursday. Escape
Mhm.
Friday, Saturday, Sunday, Monday, Tuesday.
Okay. So these are your regular days that you are usually working,
Yes.
right? Okay.
Yeah.
So what are your days off?
My days are Friday, Wednesday.
So it's Wednesday and Fridays.
Mhm.
Okay. So you find yourself working on these days off on Wednesday and Fridays.
Yes.
Okay. Is it mandatory that you work on these days, or is there something that you pick up?
Oh, something that I pick up.
Okay.
You
All
mean
right.
you mean the 2 days I'm off or the days that I'm working?
The days that you're off, on your off
Oh
days,
yeah,
the
yeah, yeah.
Wednesday,
Yeah, it's something that I pick up to help me.
Okay. So what we're trying to do is to see how we can resolve the issue so that you're not overly working. And however, you stay making your 40 hours. And even if you want to work another double of 20 hours rather than a whole 80 hours, that's something that is manageable. So that's what we're trying to look at. So on this Wednesday and Friday, which is not mandatory for you to go to work, do you think it would be wise that you either stay home on these days or try to maybe work on one of those days and maintain the Friday and stay home and rest? Would that be able
Yes,
to
sure.
cut down the hours?
Yeah,
Was that something that you would be able to do?
yes.
Okay. So, were you not working on that Friday or trying to switch either the Friday or the Thursday and make sure that you're not working on both of your days off? Um, that is something that if we look into is going to be able to help to reduce your stress and reduce the time that you're working. Would that be
Yes.
something that you're able to do? Okay. So
Yes.
having said that, we going today is the first day that we are meeting here today, and I'm hoping that we can put this thing into work and create a plan so that you can be able to work through that and see how best we can go through it. Would that be something that you'd be willing to do?
Yes.
Already. That do you have any other question for me today for this session?
Yeah. Are you going to schedule another meeting with me? Another
Yes,
section? Okay.
yes.
Thank you.
So I'm going to schedule a meeting with you next week, the same time that we can be able to sit down and we'll be able to create a plan that you can be able to work through and see if you can rebuild your schedule so that you're not burnt out and just working, 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 working. Would that be something good?
Sure.
Huh?
Sure, yeah. Yes.
Alrighty. Okay. Do you have any other question for me?
No, thank you, sir.
Okay. I want to say thank you for meeting me today, and I'm looking forward to talking to you next week, the same time, and we will meet again. Okay.
Okay.
All right. Thank you
Thank
so
you.
much for talking to me.
Thank you.